Good evening, everybody, and welcome. I hope you're all well, and thank you for joining us this evening. I just need to press a few buttons to get us started. Bear with me a moment. Okay, we're just getting everybody on Restream, so that's good. Thank you all for joining us this evening. Bear with me a moment. Right, I'll just get my screen up. It won't be a second. Great. Okay, I'd like to welcome you all this evening, and I'd like to introduce Jane Ocker, who is our glaucoma clinical specialist nurse, and Katie Scallan, who is our ophthalmology technician, both from University Hospitals of Coventry and Warwickshire. And I'm just going to launch a poll, if you bear with me a moment. Just one second. It's just going to be a short poll with one question. I've launched it now, and I'll give you a moment or two to complete it. And if you're using a screen reader, it'll make a bing bong sound. And please remember to submit. As you're filling the disclaimer out, I will read out this. We are enormously grateful to Jane and Katie for generously giving us their time to present on this webinar this evening. We specifically invite speakers who are knowledgeable on the topic being presented. The information shared tonight is based on their own experience and knowledge and does not replace any medical advice. Your circumstances are unique to you, so if you are thinking of making any lifestyle or medical changes as a result of this webinar, please speak to your eye specialist first. The Coma UK and the speakers are not responsible for any action you may take as a result of the information you learn to this webinar. Okay, I think everybody's done the poll, which is great. Thank you very much, everyone. And stop sharing now. And without further ado, I'm going to hand you over to Katie and Jane. As you can see, they're still at clinic.
Hello, sorry, I'm just going to set the that's
That's fine.
Okay.
Yeah.
Yeah, I'll start. So I'm Jane. I'm the glaucoma specialist. What we're going to do today is to have an overview of what's the patient journey when they're going for a glaucoma appointment. Yeah. Get the next slide. So, who are these people that who normally help patients when they're going for glaucoma appointments? So initially, we get the receptionist who will book you in a desk and ask you to take a seat on the allocated clinic suite. You will be meeting the nurse or the support worker who will initially check your vision, depending on what the doctor has requested. Sometimes they will ask to check eye pressures, and sometimes they will ask the nurses or the support workers to administer drops, depending on what the doctors request. And sometimes you will also see the glaucoma technicians, where the technicians are responsible to take your scans and complete your visual field test. And there are also the glaucoma nurse specialist. So on my part, glaucoma nurse specialist, check your eye pressures through the slit lamp. And I will be guided with the doctor's plan on how we go further for your treatment plan. We also have the optometrist. Optometrist will look and see your eyes through the slit lamp, check your eye pressures, check how healthy the eye be, any progression, or that, and then if anything that needs to be furtherly discussed with the doctor, they will decide it together with the consultant. And then you will see the doctor. Doctors, they look at the eyes through the slit lamp, check your pressures, check the health of the eye, and can decide the treatment plan for you. Yeah. And these are the people that you normally see in the glaucoma appointment. What are the pathways, the glaucoma patient pathways within UHCW? So we have the referral. So those patients initially that's seen by the opticians or seen in eye casualty, if they need a further referral, so they get referred to us, then doctors, these patients sometimes goes for either a doctor's face-to-face clinic where a baseline field test and scan will be completed, IOP check on the slit lamp where the angles of the eye and the back of the eyes get checked. Then we will check the central corneal thickness. So sometimes patients will ask what are corneal thickness. It's the thickness of the front of the eye, of the cornea. So that's another parameter that the doctors are looking into it. And then that's where, so if you look, we've got checking of eye pressures where the angles of the eye are being checked, the thickness of the cornea, we get the field test, we have the scan. All these are the parameters that will help doctors to plan for your treatment. And then other pathways, sometimes it depends on how glaucoma have affected the patient's eye. Sometimes you go for a 6-monthly routine check, depending whether it's a face-to-face clinic or you go to the technician-led clinic. A question, do I always need to see a glaucoma doctor? The answer to this is a short no. We have plenty of pathways for our patients to ensure that they are still getting the best care for the condition without compromising the eye health. The system has also been designed to try and combat long waiting times. So more ways to be seen than ever before. So as we said earlier on, we've got referral from the eye casualty. These patients either go to the technician-led clinic where patients are expected to be checked for their visual acuity, eye pressures. They will complete the visual field test. They will undergo the scan of the eye, and then all these tests will be completed during a one-point appointment alongside with some general health questions. So you will be asked, are you still driving? Are you still working? Any do you suffer with diabetes, hypertension? So, questions just like that. And then after completion of all these tests in the technician-led clinic, this will The pathway for this will be a virtual review by a glaucoma doctor or a consultant, and a plan to have a checkup either be every 6 months or with a technician or a face-to-face appointment with the doctor, depending on what has been reviewed following the technician appointment. Oh, sorry. And more. When and why would a patient pathway change? So, if there has been changes in the patient's test, the doctor has found something that they want to monitor closely. So those are the why there has been changes on your pathways. So if a patient is due and had recent glaucoma surgery, that's another factor. Or if a patient had a spike in eye pressure or needs a pressure check after the surgery. So clinical nurse specialist appointment in IOP clinic. So IOP clinic is just one part of the glaucoma service that we provide. So me, as the clinical specialist nurse, I specializes on intraocular pressures check, which when not well managed can cause damage to the optic nerve. Yeah. So I see patients that may have been diagnosed with ocular hypertension, which can have same effects as glaucoma if pressures in the eye is not well controlled. In my clinic, patients will have their pressure checked through the slit lamp. Same method as the doctors when they're checking the pressure check. This follows the plan of the consultant or the doctors the patient is under. I will myself has recently undergone a prescribing course as well. So hopefully sooner I can be a big help in helping follow up the doctor's treatment plan and can prescribe new drops or changes a drop under doctor's guidance. This can help speed up waiting times, and this means as a patient, you're able to get fast action if your pressure is high, which will help stop the effects of glaucoma or stop the progression of glaucoma. More.
I think that's just the pathway again.
That's the pathways, yeah. Shall we go for? I will hand it into Katie. Katie will explore more on what the technician's appointment be like during the patient's appointment.
So usually if you're sent to a technician-led clinic, if the doctor thinks you're stable enough to be seen by somebody and like a technician, and then the appointment will be sent to a virtual review, and then the doctor will review the test virtually and then hopefully send out a follow-up appointment. So it's an independent clinic where all the tests are carried out by the doctors, and the results go to virtual review. Patients will, like I say, be sent there if they think that the doctor thinks the patients are stable. We do the same test we would do in a doctor's clinic. So we do the field test, we do the OCT, so the scans of the back of the eye. We'll check visual acuity, so on the chart when you have the occluder, and we usually use the distance glasses for that, and we also check your eye pressures. In the appointment, we just ask any general health changes, making sure that you're taking the drops if you do take any glaucoma drops, and also any other any concerns that you've got as a patient, and has the vision been stable since the last appointment. We have our appointments here at Coventry, but we also have our clinics at our sister hospital at St Cross, which is in Rugby. Here's some of the main four tests that we do. Most people, if you come to clinic, will be familiar. So we do the visual fields test, the aura machine. So that's a picture of the aura machine. So that's the puffer test, and that's how we check the pressure. We check the vision on the on the visual acuity. So we'll check it on the chart, and then we'll also do the scans to the back of the eye. So we also we run alongside the stable glaucoma service. So this is for patients who again have been reviewed and they have been deemed stable, and so they've been with us for a long time, and their glaucoma has stayed stable for a number of years. So they get put into the SGS service. Patients will have a personal care plan set for them by the consultant they're under. So if this is just an example one, so usually we follow the guidelines of this particular patient who I've made up. Will have fields every 12 months, OCT every 12 months. We'll see an optometrist face to face every 18 months, and they'll have a target. So that's about right. Target IOP if we're happy with anything, send that patient for a quicker virtual review to the optometrist, who will then decide what they want to do. And then this particular example says the consultant reviews in 2027, which means that this all gets reviewed probably every 3 or 4 years. Sometimes the patients will have a face-to-face with an optometrist, and sometimes they'll come to us. If there are any changes on the field or anything, we will flag it up, and it will get sent to the optometrist quicker, and they will decide what they want to do. Sometimes they'll send it to a consultant. Just quickly, as technicians, we learn to carry out the tests, but actually we're told to we follow an SOP. So the SOP will tell us so only certain things that we have to look out for as technicians that might mean something's changed within a patient's like visual fields or something. So we couldn't tell you any results on the day of the testing. So this is just so you'll get recruited to SGS. You'll see an optom or a technician, which will follow the PCP, and then the consultant reviews the results every couple of years. So here are some of the people as well that book the appointments. Obviously, talked about people we see face to face, but there are people behind the scenes. So we have the medical secretaries that book the clinic appointments for the consultants and manage theatre lists. The fail-safe officer acts as a safety net for people so they don't get lost to follow up. We have support secretaries. They help take phone calls and manage triage and book patients on the right pathway. And the ECLO, who can assist people that might be struggling with their diagnosis or vision loss at home. And they're able to connect with the local authorities as well to help people. Our fail-safe officer ensures that patients with glaucoma are monitored properly. They make sure that people don't get lost in our system. Unfortunately, that can be sometimes that can't be helped, and people do fall off the system. But that's obviously why we have the glaucoma fail-safe officer. And we give out her number in clinic as well, so people can contact her if they haven't heard anything. We do tell patients within 6 months if they haven't heard anything, received any sort of letter, just to give us a call. So. And then the ECLO, which is the Eye Clinic Liaison Officer, they are like the bridge between the hospital and us. So as the hospital and when the patient goes home, so they can refer patients on, and they're able to assist with ensuring that, say, a patient needs help with their visual impairment certificates and that sort of thing, and if they need other support, other benefits, so they can have people who've recently been diagnosed, patients adjusting, families and carers who need the extra help as well. They have all the information that patients would need, like beyond the clinic. So once we've finished, obviously patients go home and they could be dealing with severe sight loss or been told something that obviously probably they didn't want to hear. So she can help. Her name's Nuala. She's very good as well, and she's very easy to contact, and she's very willing to help. These are pictures we had at our last glaucoma support group that we do. We try and do it biannually if we can. That patients come along in the community and we talk one of our consultants does a talk on something specific, maybe something they've heard a lot of questions come up in clinic about. It's glaucoma related, and they're able to ask questions that they might not have time for during clinic. Sometimes because we don't have such a short amount of time, patients feel like they can't answer questions. So we open up the floor, probably a bit similar to this really, but face to face, open up the floor, and then people are able to share their ideas. And usually patients talk to other patients that also have glaucoma or similar diagnosis to them. We first got contacted, well, it was Arlene, one of our colleagues, who first contacted Glaucoma UK when she wanted to hold our first awareness day. Since then, we've stayed in touch with Peter, who from the charity, who attends all of our events. So if we have an awareness day or a support group, he always finds the time to come and join, which is really good because the patients can see that there's again help beyond the clinic. We regularly hand out the number as well provided, because a lot of our patients really find the drop aids that they give really useful. It can help making sure that they take and they're adhering to their drops correctly. We also partake in the Glaucoma Awareness Week. Since we started our own technician-led clinic, when we see new patients, pretty much all of them don't really know why either they've been referred or what glaucoma is. So Arlene had the idea of raising awareness every year. We've done it twice with Glaucoma UK, and then we've also done it with the World Glaucoma Association. This is actually done in the outpatient dome that we have here at Walsgrove Hospital. So it's not just our patients we see, we see other members of staff and visitors of the hospital, and we do get a lot of people coming to ask even simple things like how often they should have their vision, have their like glasses changed or go to the opticians, which obviously even if we're making one person go and get their eyes checked for the first time, it can help maybe an early diagnosis of something. Hopefully everything would be fine, but if there was, and that's it. Thank you very much.
Great.
Thank
Thank you very much. That was really comprehensive. There's so much goes on behind the scenes, isn't there? Thank you very much, Katie and Jane. And we'll move on to some questions now. First question here. Are technician-led appointments available in every glaucoma clinic?
Technician-led appointments available in every glaucoma clinic. Yes, depending on what would be the treatment plan. There is a pathway that we need to follow according to the doctor's plan. So either you go to the technician or you go for a face-to-face doctor's appointment. But there is always a glaucoma, independent glaucoma technician-led clinic.
Great, thank you. Got a question here next. What is your IOP target?
IOP target depends, again, every patient have different IOP target. Yeah, so that one is depending on how the doctor sees on what type of target they wanted for each patient.
Right. Okay, thank you.
It varies.
Are you able to answer the next question that's there?
Okay, so we've got the top one says, do you usually have a visual field test at every appointment?
Yes.
That just entirely depends on what we follow. Usually on our system, the doctor will usually tell us if you need a field test. If they haven't put anything, we have a rule as part of our SOP. So every 6 months, unless you've had surgery, we will do a fields test. They say that the fields test lasts every 6 months. So say if you were seen in January and then you come again in like November, we would do the fields test on both occasions. But if it can change, it depends. So sometimes doctors want every 3 months or in 2 months' time. It just entirely depends on the doctor's plan.
Great.
There's
Okay.
another one.
Question here. What is the relationship between CHEC and my local hospital? But we don't know. Does that make
And
sense?
they
Yeah.
are entirely different.
Mm.
CHEC is a private managed hospital. So I think there's no relationship at all. I'm not quite sure, I but there are patients that from CHEC they get referred to us, so we
Yeah.
see them.
Great. Yeah.
Mm.
Yeah.
Okay. The next question I've got, are fail-safe officers available generally, or are they just specific to your hospital?
Oh.
Mm.
Good
Do you know,
question.
I actually think I have saw failsafe officer jobs go out on like the track website, but I'm unsure whether they'd be specifically for glaucoma
For
at another trust.
Okay, no worries. We'll move on. Thank you.
There's one on the top one. The doctor said he will review every year.
In
In
the
the last year's review, he found my vision further lost and asked me to continue the drops. It's been 6 months. I want to get my eyes checked if there is any improvement or further deterioration. How can I book an appointment with and with whom? So, if there should be whoever the consultant looking after him, they have their own secretary. I would suggest to contact the secretary and find out what would be the next appointment plan for him.
Great, thank you. Next question is easy. Are drops for life?
Depends. It depends because depending on what would be the diagnosis, there are cases for ocular hypertension. They've been put on drops to help and stabilize pressures. However, there are ocular hypertension diagnosed patient that sometimes they get offered with laser treatment. If laser works, sometimes they don't need their drops at all. And there are glaucoma patients as well that has undergone glaucoma surgery like trabeculectomy that has been taking some drops. But if the surgery works, sometimes doctor plan to stop them with the drops. Again, it varies patient to patient.
Everybody's an individual. Next
Yes.
question. If my pressure has been stable, would I still need a field test every year?
yeah, yeah, just because sometimes because well, yeah, you just would because sometimes depending again on the diagnosis, your pressures might be stable, but there still could be damage at the back of the eye, and they would want to check that if there is, if it could be getting worse. Also, it can actually a field test can determine other things as well. So if you've got more than one issue, sometimes people actually have field loss and don't actually have any don't even have glaucoma, but they'll come here for the test because that's just the way that it's monitored. It just entirely depends on your diagnosis on whether the pressures would affect the field, that like the vision loss.
Right. Okay. Thank you. The next question we have, do you take referrals from the NHS?
Yes, yes, we do have some referrals from other NHS hospitals as well.
Right. Great.
Mm.
Thank you. Okay. Next question.
What ways would you
What
say?
ways would you suggest to raise the reliability of IOP tests?
Do they mean fields tests or pressure tests?
I'm not sure. Maybe they'll come back to us and
Yeah.
explain.
Mm.
Okay, that's great. Right, we've answered
Oh,
that one.
moderate, how long overdue?
Okay, I've got some questions in the chat here.
Oh,
Um, why do I need visual tests so often?
Um,
A visual field more often?
Yeah.
why would I need them more often?
Yeah. Why would I need visual tests more often?
Visual field is one of the parameters that the doctors are looking on how the glaucoma is progressing. So depending on the damage that the glaucoma have caused, there are pathways where doctors will plan for, just like what Katie was saying, normally we go for a 6 monthly field test. But again, it varies with the patient. There are patients that goes for a between 3 to 4 months visual field test.
Great. Thank you. How long does a typical appointment take?
Um,
How long?
how long does it, as in, as in an appointment in clinic?
Yes.
It depends again. So, for a technician appointment or an appointment with Sister Jane, sometimes you can be in and out within about 40 minutes. If you're to see the doctors, unfortunately, it's case by case. So, if somebody came in and, for example, they had been lost in the system, or it has been a long time of a wait since their last appointment and there was progression or they needed to be signed up for surgery, that would take a lot longer than a patient where everything was fine and they were able to just, it was a quick pressure check and to leave. So I think they usually allow about 2 to 3 hours within the clinic, and it just saying that in the letter, just so people know that not to sort of, I think in general, people know if they're going to come here, they know not to book anything else for the rest of the day because they sometimes it can run over and it can take a long time. So again, it just does depend on what appointment you're having.
Great. Thank you.
Oh, sorry.
So, next question I've got in the chat. What should patients bring to their first glaucoma clinic visit? What
The
should
first time
patients
they
bring
come.
with them to their first glaucoma clinic visit?
So usually any drops that they're currently on, any previous any medications that they're on, their last prescription like for of glasses, their distance glasses, any previous information from any hospitals regarding any eyes or glaucoma.
Right. So go prepared.
Yeah, the kitchen sink.
Excellent. So, what is OCT scanning and why is it important?
Sorry, we can't see these questions
Sorry, they're in
ourselves.
chat.
They're in chat.
Yeah.
Where are they? Webinar chat, then. Chat. Why can't we see
When you're looking for it, I'll ask you the next question that's in the
them?
question and
Yeah.
answers. What is the difference in the diagnosis of glaucoma and glaucoma suspect?
Okay, what is the difference in the glaucoma and the diagnosis of glaucoma and glaucoma suspect?
Yeah.
When you are diagnosed with glaucoma, then the doctor are definite that you definitely have a glaucoma. Glaucoma suspect, they can see some changes, but because the parameters are not showing that it's a definite glaucoma, hence they will consider you as a suspect. But sometimes with glaucoma suspect, there are patients that been started with treatment as well. But again, it varies patient to patient.
Right. Thank you. Okay.
Is glaucoma. I have read about condition, however, it seems like the reason people get it.
We'll go back to the questions and answers, yeah?
Yeah.
What are the
Yeah.
factors that decide the IOP target?
Shall we? That's doctors. That depends on the doctor.
Right.
On how they decide IOP target and how depends on how the damage that had the glaucoma had caused.
And sometimes the thickness of the cornea as well. Yeah.
But that
Sure.
depends on how the doctor have decided.
I can see some of these questions now. Like, can I bring someone with me? Yes,
Yes.
yes, of course you can. Yeah.
Okay.
Yeah, and they can pretty much come into every room. It's a bit harder at St. Cross because the rooms are very small, but at Walsgrave, yes, people sometimes bring 2 or 3 people in. So yeah, we're not, the more the merrier.
Okay. I've
I
got
can.
another question here.
Uh-huh.
Following a SLT last week, what should I expect to happen during my follow-up appointment with my specialist nurse technician?
Well, that's my specialty. Yeah, following your SLT laser treatment, you normally, in our pathway, you normally see me, the specialist nurse, 2 to 3 weeks after your laser treatment. Why do we need to see the specialist nurse for pressure check? This is at that stage, we need to ensure that there is no spike of pressures. So despite that is why even if you have a laser treatment, the doctor will always tell you that continue to use your glaucoma drops. So by then, at that stage, we need to ensure that there's no spike of pressure following your laser treatment. After that, 6 to 8 weeks after seeing me, you need to be reviewed by your doctor again to ensure on how the laser treatment has responded.
Great. Thank you.
And there's some
A
here.
textbook answer there. Wonderful. Okay, I have read about the condition. However, it seems like the reason people get this is still not clear. Is age the biggest factor? I think we mean risk factor there.
Age, we normally say, especially with family history of glaucoma, we encourage patient up to the second degree to have their family members check as well.
Yeah.
So especially when you reach 40.
Yeah,
Right.
because sometimes you can actually people are born with it as well. So it's not necessarily age is like one risk factor, yeah, but they're yeah, it's all there's lots of different reasons. It's not a specific.
Okay. I've got a few questions in the bottom of the chat if you scroll down.
Yeah.
And it's a really good question. Can I ask questions during the appointments?
Of course,
Yes.
we are happy to entertain questions because that's the only way. Whatever questions you have to ask from us, we are happily to accommodate that because we can liaise that with the doctor.
Yeah, you have to advocate your own health as well. So, if you think that even if it means you're questioning what we're doing, we'd rather that so you know why
Absolutely.
we're doing things.
Sure. So next question at the bottom there. Will my eyes be dilated and can I drive afterwards?
Um, attending the glaucoma technician appointment, no, eyes are not dilated. The doctor's appointment, very rarely that the doctor will for a glaucoma appointment, very rarely that the doctor will dilate your eyes. However, if I would suggest if it's a doctor's appointment, just be ready that you will anticipate that your eyes will be dilated because depending on what they can find, they might end up to further assess your eye. The only way to assess it is to dilate the eyes.
Okay, excellent. Right. Next question, an easy one, I think. Who do I contact if I am concerned or worried in between my visits or appointments?
We've got the fail-safe officer. She would be the main person that we would suggest to contact. We also have the medical secretary. So whoever's your under consultant wise, their secretary. Or actually, we've actually started. I mean, this is just for our trust, and we've started giving out our number as well. So you can call the technician's phone line as well. And they can always chase or just We usually email the secretary, the fail-safe officer, or speak to the doctor on the clinic on the day and just say, this patient struggling with this or feels like their vision deteriorated. Usually they'll say try and get them into clinic sooner or next available appointment.
Great.
But if you're really struggling actually as well, and if you're concerned as in concerned as in like you suddenly can't see or
Break up a
anything,
little bit.
there's you can always go to eye casualty or go to your local opticians as well.
Okay.
Sorry, you can if there's like if it's a major change or like her headaches, nausea, that sort of thing, then eye casualty.
Great. Okay. Do I need to stop using my eye drops before the visit?
No.
That's a no, a clear no.
Yeah, unless you've been told to do so by the doctor or you've had some sort of surgery and you're on different drops. For the technician-led clinic, definitely not. Stable glaucoma for Jane's clinic, no. Probably just
Okay.
a no, really. Yeah, unless told
Okay,
otherwise.
excellent. Next question I've got. How will I be informed about changes in treatment?
How? How will I inform about changes? On the day of your appointment, doctor will inform you of any changes on your treatment plan. They will offer treatments. You will be given options of how would you go with the treatment. So on the day of your appointment, you will know what would any changes in your treatment.
Right, excellent. Do we have to pay for all the drops?
Do you
Like the
have
prescription?
The prescription?
I think.
I'm not sure if the drops. I'm sure drops. We have to pay for our drops.
Yeah, you have to
Yeah,
pay for the
the
drops. Yeah.
Unless you're entitled to a free
Free
prescription, I guess.
prescription, yeah.
Okay, thank
Unfortunately, they
you.
don't give it out for free, I don't think.
Great. And the next one,
There's a question: would SLT be repeated if the first attempt had no effect? Yeah, it can be. Yes, it will be offered again. If the patient wish to have an SLT repeated, yes, doctors sometimes will offer it.
okay, the next last question there in the box. I have normal tension glaucoma. I was diagnosed in 2016. My eyes have become extremely dry, especially the last 6 months. Who do I need to contact regarding this?
When you have an appointment with your glaucoma doctor, you can discuss about your dry eye and then you get prescribed of what would be the appropriate dry eye lubricants.
Yeah, excellent. Thank you. Right. I think that's it for questions now. Yeah.
Yeah.
So we'll start to wrap up. And bear with me a moment. I'm going to start sharing now my screen.
That are more questions. I had a question. I never get to see it.
Hold on a second. Bear with me. Oops, sorry.
There was just one question there that says, I never get to see a doctor. But I think that if it's been a long time, then and if you sometimes patients come to the technician-led clinic and they don't actually they don't want to be seen in the technician-led clinic, we will just make the doctor aware if that's the case.
Great. Thank you. Right. Okay. Thank you very much, Katie and Jane. That was really interesting and some really good questions as well. We've got the helpline details on here if anybody needs to call our helpline, if you've had any other unanswered questions. And our next digital glaucomas group is in December, and it's on anxiety and mental health with glaucoma. And that's Wednesday, the 10th of December. And we're starting that at 6:30, not 7. So if you want to join us, you will all be very welcome. And just a reminder that your circumstances are unique to you, So if you are thinking of making any lifestyle or medical changes as a result of this webinar, please speak to your eye specialist first. Glaucoma UK and the speakers are not responsible for any action you might take as a result of the information you learn through this webinar. If you have any other questions that you would like to ask related to glaucoma, please do give our helpline a call or drop them an email. The email address is helpline@glaucoma.uk, really easy to remember, and the helpline number is 01233 648170. And before you go, I would like to mention our Excellent in Glaucoma Care Award. We would like to acknowledge and celebrate the wonderful teams and volunteers at your hospital, local sight loss charities, and excellent support groups as part of your glaucoma journey. If you have benefited from some fantastic support and guidance from such a team or an individual, please do nominate them for an award. And now I'll launch the final poll, if you can just bear with me a moment. One second, sorry. Just going to launch it now in a minute. Right. Just a second. Okay, I'm just launching the final poll, which is the same questions. Where are we now? I'll give you a moment to complete that. So, a massive thank you to Jane and again, and Katie. I forgot the name there for one
Welcome.
second. I had to look at my screen. Please consider completing the survey, which will launch when this webinar does end. We want these sessions to be great. So the more feedback we receive, the better the sessions we will be able to provide. So I think a lot of you are answering the poll, which is great. So I'm going to leave that open for another bit longer. I would like to thank you all for coming this evening. I hope to see you again in December and have a lovely evening. Thank you very much indeed. Thank you, everybody.
Thank you. Thank you.
Excellent. Yeah, I'm going to end the webinar now for everybody. Thank you very much.